Hello, my name is Dana Hughes. I'm a health policy researcher at the University of California in San Francisco. Throughout my career, I've been concerned about inequities, who gets health care and who doesn't, and why the haves typically get better quality care than the have-nots. The U.S. healthcare system is considered among the best in the world, but there are enormous gaps in care, what we call health disparities. In this country, if you're poor, or if you're African American, Latino, or Native American, you are far more likely to have chronic or disabling conditions, far less likely to have access to needed health care, and far more likely to die prematurely. As researchers, my colleagues and I typically look to statistics to answer these kinds of problems. We pore over numbers, search for trends and relationships, and we hope to find evidence in the numbers that points to the solutions. But this time we decided to use a different approach. We wanted to learn directly from those most affected: people living on limited incomes, older people, people with disabilities, and people with chronic illnesses. And we wanted to hear from the advocates and the healthcare professionals who work with and for them. We went to 6 states, 8 cities, and talked to 47 people. And here are their stories.
I was diagnosed with sarcoidosis back in '93, and it took them forever to diagnose because they wouldn't take me seriously about my breathing problem. And long story short, I was told to lay down and rest, and I just wasn't taken seriously. If I had listened to them, I wouldn't be here now.
I had a patient recently who was in the hospital and was discharged to home with no preparation for her home return. Her only caregiver was her son, who was not a young man himself, since his mother was 98. And he started providing care for her in her home to try to help her recover from the pneumonia. And she was not making it. So I said, bring her into the office and we'll see what we can work out. And it took about 3 or 4 hours of effort with the insurance company to convince them to let her come in to a nursing facility.
My wife was mobile from October of 2010 till December of 2012. We never did discover what happened. We suspect that there might have been a mini stroke, and it was like the straw that broke the camel's back. She has been immobile since that day. If I had a magic wand, here's what I would have done. Rather than the government of the state of Ohio and the federal government passing notes back and forth to each other, they should have had an advisory council of consumers like myself in the very early stages, because my contention that the weak part of this program is the insurance companies really do not understand what burden we have. I don't think they have a clue. They're nice people to talk to on the phone, but have they actually, with my magic wand, I would like Aetna Molina to take care of my wife for a day.
Looking at the data locally in San Diego as far as health disparities, as far as improvement in health status, certainly we have seen some over the years, but disparities still exist. Disparities are still significant, and it became clear to me that as a practicing physician, if I was truthful about it, I wasn't making the impact that I had hoped I would make. And not just me, but I think physicians in general. And I began to embrace the change that I saw in medicine of trying to incorporate not only the physician, but a team approach. Because what I recognized was that although many of my patients have health insurance, many of my patients have access to a physician, have access to health coverage, because of the social barriers that exist, they may have access, but they lack financial resources, educational levels to help navigate the system and negotiate the system, that it was very fragmented and actually causing them to receive poor care.
In 2013, Atlantic Philanthropies funded 3 national organizations to find ways to address these kinds of problems. Those organizations are Community Catalyst, National Partnership for Women and Families, and PICO. Their common approach? Ensuring that consumers are at the table when critical decisions are made about how healthcare is delivered and who has access to it. They work especially hard for the inclusion of people who face the most serious health problems and have the least access to health care. People living on limited incomes, older people, people with disabilities, and people with chronic illnesses. Each of these organizations is committed to ensuring that health care reflects the needs and preferences of these populations and supports their health and well-being. Over the course of 3 years, they work directly with consumers to help give them the tools to sit at the decision-making table. They also offer technical assistance to healthcare providers and health plans and advocated for policy change at the federal, state, and local levels. Here's more about their work.
Comprehensive Primary Care Initiative is really focused on quality improvement. How do you improve quality? And there are a couple of ways to do that, or to get patient input in doing that. One is to do patient surveys, which we also do. All our patients are surveyed after they have a visit at our clinics. But the other way is to do it from a patient and family advisory council format, so that you actually have a group of patients that give input, partner with you to making quality improvement changes.
We have a model of community organizing that we use that involves helping individuals, in this case patients, really connect to their own story and their own experiences and learning how to use that story and tell that story in a powerful way to people who are in power and actually have access and resources to change some of the structures and the situations that these patients or people find themselves in.
If you as a consumer want to get involved and you want to help shape this delivery system, you must be willing to share with not only me, but with the state and with the plans, what's working for you and what isn't working for you. Voice your concerns. If you are comfortable advocating for yourself and for your loved ones, for your peers, sit down with us and let's shape this new delivery system.
We learn from these amazing people about the differences that consumer voices can make. Through this project, the interests, needs, and preferences of patients and their families were not only heard, but were incorporated into decision-making about how healthcare is delivered. These are just some of those stories.
I can remember a time in our past where there was even a reluctance to administer surveys because we'd be afraid to learn what we were doing wrong or what we might be able to do better. And I think that the experience has really changed people's attitudes and our providers' attitudes toward that. And I think it's because the patient family advisory councils have created an environment where our patients, it's a safe environment for them where they feel that they can be honest with us. And the feedback they give us is frank. It's not mean-spirited in any way. And a lot of it is actionable. Some of it may not be, for a variety of reasons. But I think that it's actually been refreshing for our practitioners to hear what they're doing well and to learn what maybe can be done better.
Can you give us some examples of what is a hot topic?
So, of most recent, I would say the biggest topic that our council has been successful with is really trying to talk about advanced directives or end-of-life care. So the most recent meeting was how to have this conversation with patients. We were asking for their feedback. You would think that it would come as part of a routine physical, but it often does not, and oftentimes it is found in moments of crisis where patients are at a moment of making important decisions and there has been no conversation made.
Do you have any notion of the difference that you're making here in Allentown?
I want to say I do. I'm working with the patients and observing for ourselves the turnarounds that are happening in their lives, the sense of accomplishment that the patients are having, the sense of purpose and significance, that they are valued, that they are valuable members of our communities, and that they're not alone, that people do care for them. And I think when the patients realize that someone has taken up an interest in them and is really working diligently to help them have the best life possible, have a good quality life and improved health, then we see the patients really taking some more responsibility and feeling like it's okay. You know, we've given them information, it's okay, and the response and the feedback we get from the patients is very encouraging, inspiring, and says, okay, you're doing well. It's working.
There are enormous health disparities in this country, but this doesn't have to be. There are answers, and they start with involving consumers in helping to identify the root causes of the disparities and in finding workable, long-lasting solutions.
I feel that the best way to get to the senators and everyone else is for us to tell our stories. What difficulties we're having, what we like and what we don't like about what's going on.
Have to understand that we too are human beings. And as we too are human beings, that means that if we want good people in government, if we want the system to change, if we want the system to work on our behalf, that means that we have to get involved.